Hello. Today we are joined by Dr. Mandeep Acharya, the CEO and founder of Texas Primary Care Specialists in Frisco. Welcome to FunAsia.
Thank you. It's a pleasure and happy to serve the community here. And thank you for bringing us, especially me, in this radio.
So I'd like to ask you that what makes your practice unique at Texas Primary Care Specialists?
Well, Texas Primary Care Specialist was founded in 2013, and over the last 13 years, our mission of Texas Primary Care has been to provide a high quality and accessible as well as convenient primary care service of the North Texans in this Frisco area. We do value partnering with patients in terms of their disease management, health improvements, and basically identify their disease early, which is what is the motto of the primary care. We really set apart here in this practice because we provide what you call a comprehensive, vertically integrated primary care services where patients don't have to travel to different locations. We basically have incorporated our in-house high quality diagnostic lab, imaging services, ultrasound, x-ray, CT scans, cardiac testing, we do stress tests, calcium score testing. So basically all under one roof. So we really value patients' convenience and as well as the quality of the primary care service.
This really sounds like a mini health system rather than a clinic.
That's exactly what we are trying to do here, basically providing high-level hospital outpatient level comprehensive services, but at the clinic level. So patients are provided with the best we can provide at the outpatient level and the best quality and comprehensive primary care.
Definitely, there's a lot of competency in what you're saying. You mentioned cardiac testing. Can you tell us a little bit about that?
So what we have incorporated on cardiac testing is, the patient group that we have, we want to make sure that, heart disease, which is one of the major health problems in the community, we screen them well ahead of time. We are really, following what we call a proactive approach rather than waiting and being reactive. We want to identify and screen all the patients and, with risk factors early so we can screen their heart disease. We have tools like calcium scoring. We also have tools like echocardiogram, electrocardiogram, stress testing. So that way we can identify any kind of, cardiac risk patient, which we can identify early and do early intervention to prevent any kind of major complications in the future.
So what about stress testing? You just mentioned that. What exactly is that?
So in stress testing, what happens is we have different ways to do that. One way is to have patient walk or take little steps and run on a treadmill, and we're trying to check how the heart functions when you give exertion to your heart. So we're running a little lead in your chest to check the heart's electrical activity, and we can also couple them if needed with some imaging like echocardiogram to look for any changes in the heart muscle function that comes with that exertion, which is kind of an indicator of any underlying heart disease that you're not aware of. So that's what we call a stress test or cardiac stress testing.
So to me, it seems like you're focusing a lot on prevention.
Yes,
is absolutely.
That right? Yes, because preventive care is the key right now. We really have to take these early baby steps so we can prevent getting into major complications like heart attack and stroke in our lifetime. And these small steps will take us a long way there.
Dr. Acharya, let me ask you, what inspired you to come up with this concept, this kind of practice?
Well, I have seen over the years, I keep on seeing patients, waiting for appointments, going between different places, multiple locations. It has a challenge over the years of my practice in the last 13 years to get an echocardiogram in the doctor's office. I just had to take a lot of hoops and get through a lot of referrals and a lot of friction. The patient wouldn't do that. And it comes back and next year it hasn't been done. So I think it has helped to build this kind of integrated practice model, so we can basically provide all the primary care level of service that we can provide at this facility that would take care of the patient, and then we provide them with the best care.
Yeah, the care, I think, is the word. You have that care for your patients. I would also like to ask you, why is it so important to have, these days, why is it so important to have a primary care physician?
Well, a strong primary care physician is basically an integral part of a long-term health plan. A primary care physician will diagnose your disease very early. A primary care physician manages your basic health problems that we see in the community: high blood pressure, diabetes. A primary care physician also becomes your trusted health partner who will work with you and navigate in different complex parts of the health system in terms of getting referral, coordination, orders, who's the right specialist to see, because there's a lot of decisions that needs to be made in our health where the primary care physician becomes our trusted partner on our side.
So with this health situation right now, do you see any common mistakes that people are making these days?
Well, the big mistake is just waiting for too long. Patients are just waiting until it's the last minute and serious problems arise. So primary care is the key. The patient should be going and taking these early steps, going and getting regular health checkup, screening. So problems are identified way early, 10, 20 years ahead, even if it's starting to build up, to stop that. So we don't develop any kind of diseases later in life and have kind of complications and things like that.
So you have a very preventative approach. I'd like to ask you, who benefits from these kind of services the most?
Well, we are a comprehensive primary care, so we are really wide range. We can start from basically all the professionals that we have in the area to all the families that we serve in the community. We also have seniors that are our patients, so we have got a wide spectrum. And now with the addition of an urgent care facility, now we're also able to serve children and kids to help them with their needs there as well. So essentially we have a wide scope of services.
Oh, okay. So I also understand that you opened an urgent care. Is that right?
Yes, absolutely. So there are certain situations where healthcare cannot follow the schedules, right? We have like 8 to 5, but there are times we are sick later on, we have to go and see the kid, get care after hours, weekends. So there was a lot of challenges that we faced. So to kind of mitigate that, and so we can find like a integrated model, so we can provide both primary care and urgent care for all of our patients and also the community we live and serve here. So that was the reason we opened the urgent care, so it can provide both of those types of services to our patients. So that's why we opened that urgent care recently.
I see. Well, congratulations.
Oh, thank you.
The one thing I'd like to ask you is, like, how do you know in which situation to go to urgent care versus ER? That emergency versus urgent care?
Well, that's a good question. I think that's actually a very good question, because a lot of times people think that, I just need to go to emergency room, which definitely is, significant, cost barrier too, and sometimes a lot of, resistance and friction, because it's like a next level of healthcare. So a lot of health problems which comes in an acute basis, like I would say a minor injury, a little cold, cough, an allergic reaction, which is not really serious.
Okay.
So all of these, like a UTI or like a skin rash or any kind of test for COVID. And then in addition to that, physicals, like a sports physicals, for the kids, employment physicals. So all of these kind of services can be easily done at an urgent care level.
Okay.
And not everything has to go to emergency room. Even somebody comes with any kind of concerns, we can do a basic triage at the urgent care and even decide whether this can be handled at the urgent care. And maybe we also have primary care, as I just mentioned, with all the tools that we have here, like especially with all the integrated advanced diagnostics. We can utilize that and probably be in a better position than probably a lot of other urgent cares, we are probably better equipped to identify and probably prevent those emergency room visits for the patients.
In fact, that's what I would like to find out now. Like, is your urgent care different from other urgent cares?
Right, so that's exactly the answer. So we have an integrated model because we have primary care, we have urgent care, and we have backed by hospital level advanced diagnostics.
Okay.
So which is not very common. We're in a different kind of position here, so we can really find out if something is going on with the patient. They need some ultrasound done quickly, even if they need to have some CT scans done to find out something that may not have to go to emergency room. We can kind of address that. We have in-house labs. We can get that seamlessly in the system, so that way everything goes smoothly and basically a good experience and convenience for the patient.
So what about walk-ins? Do you accept walk-ins, and what are the hours of this particular facility?
So the urgent care does accept walk-ins, only in that specific location of urgent care we have opened. And we are open basically from 8 a.m. in the morning to 7 p.m. in the evening. So we are basically all day at the urgent care, and we're also open on weekends.
And it's basically open to everybody, including children.
Everybody, including children.
Okay, that's really great to know. I'd like to ask you, how is your care model different from larger clinics that are out there?
I think that's a good question.
The chain clinics I'm talking about.
Right. So as we just discussed, this is a physician-led and basically personalized care model, because we really get into much detail and personalized approach of patient's health. We basically value that patient's time and convenience, and then their autonomy. So a patient is not going to be just a number like we see in chain system.
Yeah.
We do value them as a patient, and we have integration with primary care. So that will also be in a different position, because we can support if somebody needs that follow-up after urgent care. Then we keep that option open, and we can just allow them to follow up and kind of take care from there if necessary.
But how do you ensure that primary care that you are saying, how do you ensure that?
Well, so primary care, we have multiple options. So on the primary care side, obviously it's the same electronic medical record system, so there's a good visibility on both sides. So care that was provided is quickly visible what happened.
So it's timely also?
It's very timely. So as soon as patients are seen, we have a protocol to be following up within a week.
I see.
Yeah, and even next day if possible.
Okay.
So that fast we can see the patient. We have, multiple providers that we're accepting patients. So we will be able to get anybody in as soon as today.
So just to give a scenario, for example, you have a patient and that patient runs into an urgent care situation. So when that patient comes to the clinic, it's very personal, because you already have all that primary data for the person.
Exactly.
I see.
So we'll be in a better position than if somebody went to outside urgent care, and then they are coming here for primary care. Sometimes we don't have any information unless they bring something, or then we kind of request the records, and then that we create a delay. Obviously it takes up to 1 to 2 weeks or longer to get that. And if I need to see that patient, it's just difficult.
No, definitely. I feel like the people who are already your patients, it's an advantage for them, because you are also offering, urgent care.
Absolutely.
But it's also open to other people, correct?
Absolutely. The whole community. Okay. We are welcoming the community here.
Well, I'm very curious to know some of the biggest health concerns that you are seeing right now. I know we talked about, if you could talk a little bit more about that. What are your biggest health concerns, especially in the South Asian community?
Well, one thing as we have seen is stress, and then health problems related to metabolic syndrome. And I think we see a lot of professionals here that live in the community, and definitely the busy schedules and not trying to find enough time for their own health, and that kind of takes some toll sometimes, and we become their trusted partner and try to navigate that and kind of work on the cholesterol, the diabetes risk factors, the high blood pressure, and then just kind of work with that and try to improve their metabolic syndrome. And that has been like a main thing that I've seen in this Frisco, North Texas area.
So are you currently accepting new patients?
Yes, we are accepting new patients, and as I said, we can see the new patient as of today. Like we can immediately get them in. As I said, in urgent care, we can get them walk in right away. In primary care, there is a little bit more process, but still we can get the patient in the same day we're accepting in primary care as well.
Okay. So what's the one piece of advice I would like to now ask you, Dr. Acharya, that you would like to give to the listeners?
Well, one thing I would recommend is, first of all, like I mentioned, do not wait, because that's the one thing that people do. So please do not wait. Find a primary care physician who works and with on your side, like a trusted health partner who can help you navigate with your health concerns and be your best health partner to basically improve your overall health long term, so you don't get into any kind of health problems in the future. And if you already have a good health, then the health partner will make sure that you'll make even better health. So I would recommend that to all the listeners.
And finally, I would say that people who want to come and see you, what should they do? They just want to come and find out if this is the right fit for them. Can they come for a consultation?
Absolutely, they can come in. We are open Monday to Friday. Primary care clinic is open. As I said, urgent care is open every day. We have our website. You can check us out at www.txprimary.com. You can also make a phone call. Our phone number is 972-643-8727. You can go, phone call. We accept all the patients. If you just walk in, we'll be happy to explain all the details and answer all your questions. We can maybe give you some tour of the facility if you'd like to see. And then you can make your decision how do you want to proceed. We're happy to serve the community and take on all the patients, new patients.
Well, Dr. Acharya, it has been a pleasure interviewing you and finding more about this practice and how great it is going to be for people and that element of care that you extend to the patients. So I wish you all the best and thank you so much for being here.
Appreciate it. Thank you so much, and thank you for having me here.
Absolutely.
Thank you.